Welcome to Montana Matters. We're joined by Dr. Scott Manhart from Periodontal Specialists of Montana. So great to see you again today. So periodontal disease, we've spoken about in the past, is very, very common, more common than a lot of people might know. Maybe summarize that for us, just how common it is.
According to CDC, about 50% of adults over 30 have moderate to severe disease. You will hear statistics as high as 90% in some studies, depending.
Okay, so really this can hit a lot of different age ranges.
A lot of different age groups.
Okay, so talk to us about some of the signs and symptoms.
Typically, the disease onsets fairly innocuously. You don't see a lot of overwhelming symptoms. Hot and cold sensitivity, thermal sensitivity, bleeding when brushing, these sort of things that people tend to dismiss actually are the early stages of the disease.
Okay, and so today we're really talking about some of the treatment options, resective, regenerative, supportive care. Maybe if you can go through all three and just explain what are the options.
Well, historically, periodontics has typically had to rely on resective care, which basically means removing infected tissue. Wasn't always pleasant, but that was our only tool for a long time. In the last 20 years, the focus of the treatment has focused more onto regenerative care, which means trying to regain some of the tissues that were lost, some of the bone and ligament that was lost to previous destruction. And this can be done in various ways, through bone grafting, through growth factors. Some of the growth factors now are even recombinant growth factors and are very good at doing that. The latest step forward in the regenerative area is the use of certain lasers, which can basically accomplish the same thing, working in a smaller area and creating a site that's going to tend to regenerate on its own and not rely as much on the application of bone grafting and growth factors and that sort of thing.
Okay, so what does this mean for the patient coming in? Is it a more pleasant process? Do things recover quickly? How does that work?
The main things are faster recovery and less postoperative discomfort. We don't see as much loss of the soft tissue, which is a significant aesthetic concern, particularly in the front teeth. Less thermal sensitivity. People just get back to normal a lot faster.
Okay, so this is really something when someone comes to you, they're having a lot of health issues and problems to begin with. So having these solutions that can help them on the road to recovery quick is a really, really good idea, correct?
Yeah, very true.
Okay,
very true.
Okay, very good. Well, it's all about getting a second opinion also. When is it a good time?
Basically when you've been told that you may need more invasive therapy other than routine cleanings, deep cleanings, or possible surgical interventions. It never hurts to get a second opinion on those sort of situations.
Okay, very good. And in an upcoming show, we will talk a little bit about periodontal disease and how it can affect other areas of health. And for right now, if you'd like more information, we'd invite you to visit their website, and that is healthygumsmontana.com. You can also give them a phone call. The phone number is 655-7970.